Europeans are generally satisfied with their healthcare system, but they're also worried about its future. Why? Four concerns threaten the current healthcare system in Europe. In this report, we look in particular at the Netherlands, Germany, Britain, Denmark, and France. Costs. In 2001, 9% of GDP on average in these countries was spent on healthcare. By 2009, this had risen to 11.3%. How long can this go on? Finance. Meanwhile, economic growth in Europe is slowing down, with annual growth in the next 5 years expected to average just 1.6%. Who will pay healthcare's rising costs? Aging. In addition, over the next 25 years, about a quarter of the population of these countries will be over 65 years old. That will likely mean more people with chronic diseases which are expensive to treat. Lifestyle. On average, nearly half of the people in these countries are overweight, and around a quarter are smokers. This can only impose further cost burdens on the system. All those trends put pressure on healthcare systems. Although these complex systems are not easy to change, sound reforms can work. Each of the 5 countries in this study has made impressive strides towards reforming their healthcare systems to cope better with the challenges ahead. Using market forces. In the Netherlands, a partial shift to private insurance has helped put the power of choice back in patients' hands. Patients can choose among identically priced insurance. If they feel they are not receiving proper coverage, they can switch insurers. The idea is that competition will improve the efficiency of both medical care and insurance. Coordinating care by illness. In Germany, coordinated care centers have sprung up to offer joint diagnosis and treatment of specific illnesses. For example, a headache center might offer the joint opinion of a neurologist, a psychologist, and a physiotherapist as to the cause of a patient's migraines. This saves administrative costs since patients receive one-stop and higher quality care. Tracking medical outcomes. In Britain, for the past decade, doctors have filled out reports on the outcomes of operations. Recently, patients have joined in, filling out questionnaires about how they feel after their procedures. The combined data from doctors and patients helps to guide policymakers on what works best in healthcare. Automating patient records. In Denmark, all general practitioners fill out automated patient records, which are then made available to all other doctors treating the same patients. This helps doctors to avoid medical mistakes and saves them administrative time. Coordinating medical and social care by region. France is planning new regional health agencies to coordinate medical treatment and social care for those who need it. The aim is to improve coordination among agencies so they are not duplicating their efforts. Each of these cases provides only a partial solution. Collectively, they show the type of healthcare system that is needed for the future, one that is efficient, effective, integrated, and informed.